This is Brent of the Brookbush Institute, and in this video we're going over static manual release of the biceps femoris, or the lateral hamstring group. Now if you're watching this video, I'm assuming you're watching it for educational purposes and that you're a licensed manual therapist following the laws of your scope of practice in your state. That means athletic trainers, physical therapists, massage therapists, chiropractors, osteopaths, you're probably all in the clear. Personal trainers, this video probably doesn't fall within your scope, although you could use the palpation portion of this video as part of a learning experience, especially learning your anatomy. I'm going to have my friend Sonia come out. She's going to help me demonstrate this technique. Now, of course, before I do any manual technique, I'm pretty much 80% sure that the muscle I'm going to target is involved in the dysfunction, and the only way I can get there is through assessment. So with Sonia, we're going to make up a little case. We'll say she came in complaining of a little knee pain when I did her overhead squat. Maybe she had some knees bow in. When I did goniometric assessment, she was missing a little hamstring length, right? That test where we're at 90 degrees of hip flexion and then we see how much knee extension is left over. So I have a pretty good idea that biceps femoris overactivity is part of her dysfunction. Now, all of these static manual release techniques follow a very similar protocol. We need to be able to palpate the muscle. We get bonus points for knowing where the trigger points are. We should probably know if there's any other structures around that muscle that we could potentially insult, something like a nerve or an artery that we want to stay away from. All right, and then once we get all of that figured out, we want to know what position should the patient be in for their comfort, our comfort, and so that we have some control over the amount of tension within the muscle so that we can help localize or stabilize those tight fascicles and trigger points. In this case, the biceps femoris, right, is on the lateral side of the posterior thigh, so this is the outer hamstring group. You can see I've marked off the trigger points. We have a long head and a short head of our biceps femoris. The long head trigger point's right about here, short head is right about here, and you guys will see that a little closer when we do the close-up recap. But generally speaking, guys, these trigger points are right in the middle of these muscle bellies. So if you know that the biceps femoris goes from ischial tuberosity, right, to fibular head, then that's about center. And then the short head of the biceps femoris comes off that linea aspera at about halfway down. So if I go half the distance of her femur to fibular head, that's pretty close to center. Now for the short head, we can go in prone and still have some control over how much tension we have in this muscle. Remember, your short head doesn't cross your hips, so all I have to do is be able to control how much knee flexion and extension I have. I'm then going to use my kind of palpations this way, my strumming palpations from medial to lateral, to try to figure out where are these tight fascicles. All right, so I'm just going from medial to lateral, and I notice that this fascicle is pretty tight. And then you'll notice I put my hands down pretty close to where those trigger points are, but if I start moving from proximal to distal now, I want to see if those tight fascicles are attached to maybe a tight nodule, maybe a local point of hyperactivity that I can really pin down. And I'm going to add just a little bit more tension to this muscle here because, as I've explained in some of these other manual release technique videos, if you don't put a little tension within the muscle, you start playing that game of like trying to put your finger on top of a marble. Like every time you push down, it slips out. So I want enough tension this way that I stabilize that point. And I think right about there. I got Sonia making a little face. That's a good point. I'm just going to use pressure from my thumb. Now if I wanted to, if I felt like I needed both hands, if I was a smaller therapist, let's say, and Sonia was a huge individual, which obviously she is not, I could use a dowel or maybe my knee to keep her in this position and then use my thumb over thumb technique here so that I don't have to wear out my hand. Notice that my elbow is locked, guys. Like I'm trying to get my body weight up and over the pressure I'm using. I'm not using like my grip strength. You don't want to wear yourself out. And of course, after about 30 to 120 seconds, I actually start to feel the increase in tissue density that I identified disappear. It'll actually start to melt or release, which is where the name of these techniques come from. Sometimes you can actually feel a release happen. If you ask your patient, how does this feel compared to when I first put my fingers down? Is it as tender?
No.
No? Right, so it's not as tender. Usually it'll be really tender when you put your fingers down, and over like 30 seconds it starts to calm down. A lot of it calms down within the first 10 seconds. All right, so that's short head, guys, and once again, I'm gonna do a close-up recap, so if you didn't see exactly what was going on, don't worry about it, just keep watching. Go ahead and flip over for me, Sonia. Now for the long head of the biceps femoris, the long head actually crosses the hip, so I have to be able to control both her knee and her hip. In this case, all I'm gonna do is take Sonia's leg and I'm gonna put it on my shoulder. I'm then gonna use my same palpation skill of medial to lateral, kind of strumming to find the tightest fascicles. In this case, I'm gonna start a little distal of where that trigger point is. Once I find the tightest fascicles, I can then start moving a little bit more proximally. Once I find the tightest point, and that's a little trickier with the biceps femoris than some of the other muscles we've gone over. They're long, stringy muscles, so you might have to search just a little bit. There we go. Make sure I have enough tension in her biceps femoris to stabilize that point so it's not flopping all over the place underneath my thumbs. And then you guys notice I've actually gone thumb over thumb here. I'm obviously not going to be able to get my arms straight in this position, but at least I can use both hands to apply that pressure. And I am trying to use my body weight here to lean forward with my hands. How's that feel?
Feels good.
Feels good?
Mm-hmm.
Sonia's a little masochistic. She likes pain. But this is one of those techniques where if somebody does enjoy massages, they'll like it because they'll feel that release happen, and usually pretty quick. Usually 30 seconds. You'll start to get a good release. You could be here up to 2 minutes if you have somebody who's really, really overactive. So once again, guys, make sure that you are careful with your own body position. Everybody is all about patient comfort. I don't see a lot of patients in super uncomfortable positions. I do see a lot of therapists put themselves in uncomfortable positions, which is going to affect your longevity. And if you plan on doing this for a long time, you need to really watch your own mechanics. I'm lucky in this office that I have so many mirrors that I'll even catch my own bad posture on these techniques. Next, we're going to go to the close-up recap, guys. All right, we have Sonia in position to do the long head of her biceps femoris. Remember, when we're releasing the long head of the biceps femoris, we want control over hip flexion so that we can place a little bit more tension in those tissues so that we can pin down those overactive fascicles as well as the trigger point we're going to go after. I'm going to start with my medial to lateral or lateral to medial strokes pretty close to the center of the belly of that muscle, which is where that trigger point tends to be. If I go medial to lateral and lateral to medial here, I'm looking for the most overactive or the densest fascicles, and you guys can notice that I'm between this mass here, which is her vastus lateralis, and this mass here, which is actually her medial hamstrings. I actually notice a nice tight fascicle right there. I then can move from proximal to distal, or distal to proximal or proximal to distal to try to see if that overactive fascicle is associated with a trigger point. I got a nice little tense nodule right there. Once I find that trigger point, I'm going to go ahead and press just enough to start getting a little bit of tension back from the tissue, right? So as I press in, you'll notice tension kind of increases on an exponential curve there. I want to be right in the trough of that exponential curve. I don't want to press it all the way down. I'm not trying to like put a hole in her leg. I don't want to see how far or how much tension I could place in those tissues. Just a moderate amount of tension, and then I'm going to hold. Notice that my arms are at about 90 degrees here, guys, so all I have to do to increase tension is lean forward a little bit. I don't need to use my grip strength. I can also use my body here. I can lean forward a little bit to add a little bit more hip flexion and increase the tension in the long head of her biceps femoris if I need to pin down these tissues. Once I get a release, I get a reduction in discomfort from my patient, I can go ahead and move on to the next muscle or the next trigger point. In this case, we're going to move on to the short head of the biceps femoris. So I'm going to have Sonia flip over for us. Alright, and you guys can see here I have this trigger point marked off too, but we'll pretend that this X isn't here for a second. We know that the short head of the biceps femoris attaches to the linea aspera and the fibular head, and right between it in the middle of the belly of the muscle tends to be where the trigger point is. So I'm going to go ahead and use those same medial to lateral and lateral to medial strokes to find the tensus fascicles, and once I do, I can start moving either proximal to distal or distal to proximal to try to find any nodule that may be associated with those overactive fascicles. Once I find it, I can use my thumb over thumb technique. Of course, if you guys wanted to play with the amount of tension within that muscle, I can control the knee with one hand and use one hand to do the release technique. Once again, we'll hold 30 to 120 seconds or until we feel a reduction in the density of the tissue. Make sure you're not pressing too hard. It does take a little bit of practice to know how much pressure to apply with these techniques. So there you guys have it, static manual release of the biceps femoris or lateral hamstring group. Make sure that before you do these manual release techniques, you have a good working hypothesis of why that structure may be overactive. Ideally, before you would try any of these techniques on a patient or client, you would also practice them on a colleague or maybe a mentor with great manual skills who you look up to. There is no substitute for getting feedback from another manual practitioner. I hope you guys enjoyed this video. I look forward to hearing your comments. Please leave your comments below. I'll talk with you soon.